Howdy everyone, Matt here. I got a question for you. How much should personal experience be weighed when making healthcare decisions versus what is out there as proven evidence? Now, before we get into that, let me introduce myself. My name is Matt. I'm Matt the PT, and I'm coming at you with another video on another topic of something in the physical therapy world. Second of all, thank you so much for taking time out of your day to tune into the channel. Thank you for the likes, the comments, and subscribing. And if you do so feel inclined, hit that subscribe button down there below. It won't cost you a copay or anything like that. Now, like I mentioned earlier, I really want to talk about that. How much should personal experience be weighed when making a healthcare decision? And I want to talk about this on both sides of the spectrum, from patients making decisions with us or for general, and even us making decisions for PT or health in healthcare. Now, this came about from earlier this week. I made a video. If you've seen my stuff, I try to do entertaining, funny videos out there. And it was a video about when you overhear patients saying they're just doing PT to get an MRI and surgery. If you work in physical therapy, which is my content, that's who it is geared towards. You've most likely had that person there that came in, that sat down and goes, I just want the MRI. I just want the surgery. I just want the MRI and the surgery. And we recognize through our training, our clinical skills, our clinical judgment, that very often that's not really indicated. That's not needed. Like, you don't need an MRI. You don't need a surgery because there's indications for that. And you're just not happen to be one of them. But on the flip side of that, if you are indicated for it, hey, we want to go get it because, we do this because we want to help people on it. And we understand that there's a lot of evidence that shows that if you go and have that done, you can have a lot of negative side effects. I'll bring up, starting off, personal experience in it. Where I was from, when I was seeing patients back home in Mississippi, I cannot tell you the number of people that had went to their primary care physician for like a minor back pain or a knee pain or a shoulder pain and never referred the patient to therapy or anything. They would go to the primary care. Primary care looks like, oh, we got to send you to a specialist. Send them off to the specialist. Again, this person is just not doing anything, just mostly just taking medication. The specialist, well, let's get an MRI. Come in and they tell them, again, we know what they're going to find on imaging, or the common things that they're going to find. And then this person ends up getting at least epidural injections, most likely surgeries, and not from the surgeries for like spine, but like fusions and scopes and stuff. And this person just got worse over time. They just got worse and worse and worse. And then they would say like, okay, we'll go do therapy. And I'm like, you put this person behind the 8-ball on them from doing all these invasive procedures to them. And now you want me to try to rehab them at this point? Like, why was that never indicated earlier? And it typically just started again with a MD visit and an MRI and just found these things. I can't tell you the number of people, and it was heartbreaking. That's my experience in the healthcare world, and that's one thing that when I work with patients is try to educate them as much as I can about, these are the benefits of things. These could lead to other things. I don't want other people ending up like that, because you would see that as a therapist. These people who are hurting so bad and their quality of life is diminished so much. But this video got out to the general public because it would just start trending. And they were all, oh my gosh, there's comments all over the place. Some people, and again, I don't really care on it. People are, like 99.99999% of people would never say this to your face. They're hidden behind a screen so that, of course, they don't have faces or anything on their profiles. But it typically fell into two things. And it was somebody's opinion is to say like, no, they need to do an MRI before they do anything else on it. And you try to educate that person to say, no, let's look at this evidence on it. And then they would just disappear, or they would just want to argue with you, which is not even worth it. Or two, it was somebody's personal experience on that. Now, I would completely understand, and this would probably, if we start looking at stuff, I post stuff about physical therapy. People are going to talk about the negative, their negative experiences with physical therapy. If surgeon posts about surgery, there's probably going to be people who post about their negative experiences with surgery. The dentist talks about dentistry. There's people going to be posting about the negative aspects of like people just want to voice their negative aspects about what's going on. Now, something I was really trying to do with many of these videos with many people is try to educate them to say, yeah, your experience was valid. That is something that happens on it. And there's no guarantee that any imaging done before would have caught any of that on it. And a lot of it does boil down to a physician's and their PT's ability to assess and to catch any of these serious things. I also noticed that not a lot of people actually explained what happened after the surgery. Like a few people said, like, yes, I felt better after I got the surgery, but the vast majority of people never said anything afterwards. So, I mean, what do I assume? Like, that it fixed you, or no, it was just something that you got and you just going with that? That's probably a talk for another time on something else. But really, seeing this right here, we understand that's not always the case on it. Again, my personal experience, that can be a case of it. There's also that mass of information of out there that shows that things like imaging and surgery are not beneficial early on with any kind of musculoskeletal thing, with musculoskeletal things going on outside of, again, those serious pathologies and things that we see. But how much does that person's experience go versus a large amount of information on the other side that contradicts that says, no, that image was not warranted early on for most people, because somebody could be having the same issue that you had, but there's a lot of other factors and things going on. Now, like I said, there's a lot of information that I've got. I'm trying to read through it and learn more and more about this, again, overall. But how much should that go with people talking about rehab or healthcare decisions when you got these people saying, this is what my personal experience is? It's like, okay, yeah, you had this case, but if we got into it and we broke this down and understand. I mean, I had somebody talking about they had a cauda equina and they had to go 10 years or something before they caught it. It's like, that's an extreme case of it on there. Or people saying like, oh, they did that and they found all this. It's like, yeah, there is these indications when it's like, yeah, if you were sitting in front of me and I assessed you, we went through that, yeah, I would have indicated for you to go get an MRI because it wasn't really going to get better off of that. So let me know what you think about that with terms of people, patients and, the general making decisions and things based on their personal experience. Now, I want to flip it over to the PT side. I shared my experience on that with what I saw and where I was. And this could vary place to place. But how much do our personal experiences weigh in making healthcare decisions for patients? Now, that really could come down to things like treatments on it. And this is really a big area of debate about what's the best treatments and stuff for people. But what is, we see that there are people that post their treatments. I don't post any of my treatments online. I don't, it's just, there's other people that do better jobs that talk about different things on there, and that's their content. That's just not mine. But we get people that will post like, okay, this is a day and this is what I'm treating with people and this is that. But we get other people that will come in that will comment negatively about them on it. And it just runs the whole gambit of stuff. So there's people that talk about, doing things like scraping and needling. And then there's people that come in and say, no, that's not right. That just doesn't help. But then there's other people going, well, in my experience, it does help benefit to get people up and doing this and doing that and doing this. And it turns into a big battle on it. Even things with like ultrasound on it. When people talked about, like, I am not an ultrasound fan, but I have legit seen people post about utilizing ultrasound in their treatment and defending it so heavily, saying, in my experience working with my patient, I get these great outcomes with using ultrasound beforehand. Heck, I even know of a very well-known therapist who puts people on heat as a warm-up on it. He gets great results with all of his, with all of their patients. And he puts it, again, and it's like, again, evidence doesn't show that that's really going to be super beneficial. But what do we do? What do we do on it? Now, I do believe that very heavily with treatments that we are very defensive of how we treat. We feel like we are doing the best that we can with patients. And we all feel like our patients are individualized on it. And I think that kind of goes over with patients, that often, people will say that, I got back pain, but I've got this and I've got this and I'm this and I'm this. And it makes it more individual on it. I saw somebody kind of talking about cases with this, like, hey, well, this is what this evidence shows here. And it's like, well, and then somebody will say, well, what about this? And well, then this, and then this, and then this. And then they'll just kind of add little things to it until they're just like, okay, there's these one-off little cases on it to say like, okay, no. See, I just don't fit into that. And it seems like people would, therapists will do that with their treatments. Like, okay, well, you say this, but look at, well, what about this, and then this, and then this, and then this, and then, okay, well, this is the little caveat that goes into it. I know. It's a big thing. I don't think it's ever really, really going to change on that. But let me know. Let me know your thoughts and beliefs on that. How is it with others? Now, granted, like I said, dealing with people on the internet, it's going to be hard to change somebody's mind on that, because most of the time people just want to voice their opinion. I just want to get this out there. I don't want to listen to anything and talk about that. But what do we do about that with ourselves? And how much does our personal experiences come in to say, this is how I treat and this is how I do stuff because I'm comfortable with it, versus what is out there in the evidence? Now, I do say it's good to challenge yourself and to do those things. And lastly, how do you change people's minds when they're in the clinic in front of you? Is that patient that comes in and going, I'm just here to get the MRI and the surgery on it. And how do we best just work to change their mind, to say, like, well, you may not really need that. How do we build a rapport? But I do believe, and I will say this, I will really say this. Granted, from all that stuff out there, I do believe once we get face-to-face with patients, that we do spend quite a considerable amount of time talking with them, building rapport, doing our best to educate them on it. But we got a long way to go. I understand that. We all got a long way to go. Let me know your thoughts and beliefs and opinions on that, or any other areas of topic or discussions on that. I think this is something very big. And again, I'm just kind of scratching the surface on this. So again, how much should personal experience? And again, something that is funny that comes up from that is that I believe sometimes we may pick and choose when personal experience comes in versus research and evidence and stuff like that. But it's like, oh, look at all this evidence over here. Okay, well, how about this? And it contradicts. Well, then my personal experience. So anyway, I hope I didn't ramble too much on it. But like I said, let me know your thoughts and opinions and beliefs on all that. We'll, if we have to expand this out and talk on it. I do think it's a very, very interesting topic. But like always, take care of yourself, take care of your patients, and I will see you next time.